Joint cracking, also known as crepitus, is a common occurrence for many people. It can happen when you move your joints, such as your knuckles, ankles, or knees. While joint cracking is often harmless and painless, it can become a problem when it becomes frequent or accompanied by other symptoms. The sound of joint cracking is caused by the movement of gas bubbles in the fluid that lubricates your joints. This fluid, called synovial fluid, helps to reduce friction and wear and tear on your joints. When the joint is stretched or moved, the pressure in the fluid changes, causing the gas bubbles to pop, which creates the cracking sound. However, in some cases, joint cracking can be a sign of a problem. If you experience joint cracking along with pain, swelling, stiffness, or difficulty moving the joint, you should see a doctor. These symptoms may indicate an underlying condition, such as osteoarthritis or rheumatoid arthritis. Another condition that can cause frequent joint cracking is hypermobility. Hypermobility is a condition in which the joints move more than they should, which can lead to pain, instability, and an increased risk of injury. In addition, if you notice that your joint cracking is becoming more frequent or severe, you should also see a doctor. This could be a sign that the joint is becoming more damaged or that an underlying condition is worsening. If you do see a doctor, they will likely perform a physical examination, ask about your symptoms and medical history, and possibly order imaging tests such as X-rays or MRI to help diagnose the problem. In most cases, joint cracking is harmless and requires no treatment. However, if it is caused by an underlying condition, treatment will focus on managing the condition to reduce symptoms and slow the progression of the damage. This may include medications, physical therapy, or in some cases, surgery. To prevent joint cracking and associated problems, it is important to take care of your joints. This includes maintaining a healthy weight to reduce stress on the joints, engaging in regular exercise to keep the joints mobile and strong, and avoiding activities that may cause excessive stress on the joints. In conclusion, joint cracking is a common and usually harmless occurrence. However, if you experience joint cracking along with other symptoms, such as pain or difficulty moving the joint, it may be a sign of an underlying condition, and you should see a doctor. Regular exercise, maintaining a healthy weight, and avoiding activities that may cause excessive stress on the joints are some of the ways to prevent joint cracking and its associated problems.